Welcome back to the Reimagine Healthcare podcast. I'm your host, Noah Voles, coming to you once again from Phoenix, Oregon. Today, we're going to talk about something that sounds almost impossible in modern American healthcare. An organization that covers 67,000 people, manages hundreds of millions of dollars, and operates without a single stockholder demanding quarterly returns. No corporate headquarters in a distant city making decisions, no private equity firm extracting value while cutting services, just healthcare designed to serve people and strengthen communities. That organization is Jackson Care Connect, and it operates right here in our backyard. If you live in Jackson County, there's a 1 in 4 chance you're covered by Jackson Care Connect, or you know someone who is. More than half of all children in our region receive their health care through this organization. But even if you're not a member, even if you have private insurance or Medicare, Jackson Care Connect's existence shapes your healthcare reality in ways most people never realize. What I want to do today is pull back the curtain on how Jackson Care Connect actually works, why its structure matters for everyone in Southern Oregon, and what it teaches us about the question at the heart of healthcare reform. Who does healthcare serve, and who decides how it operates? These aren't abstract policy questions. They're questions that determine whether surplus healthcare dollars flow to distant shareholders or get reinvested in services locally. They determine whether decisions about your local healthcare system are made by people who live here and understand our community, or by executives in boardrooms thousands of miles away. This is a model that's been operating in Jackson County since 2012, producing tangible results that we can measure and learn from. It's not perfect, and I'll talk about where it could be even stronger. But it represents something rare in American healthcare, a working alternative to the corporate model that dominates everywhere else. Let's start with a basic reality check about American healthcare. Most healthcare organizations in this country exist primarily to benefit someone other than patients. For-profit insurance companies serve stockholders who expect profit growth. United Health Group, the nation's largest insurer, generated $324 billion in revenue and $23 billion in profit in 2023. That's billion with a B. That profit flows to shareholders as dividends and stock buybacks. It doesn't go to community health improvement. It doesn't fund school-based clinics or withdrawal management services. It goes to investors, many of whom have never set foot in the communities where that profit was generated. Private equity-owned healthcare is even more extractive. When PE firms buy physician practices, urgent care clinics, or specialty services, the explicit goal is value extraction over a 3 to 7 year hold period. They're not thinking about long-term community health. They're thinking about how to maximize the sale price when they flip the practice to the next buyer. That means cutting costs, increasing patient volume, and extracting as much revenue as possible before moving on. Even corporate hospital systems, many of which are technically nonprofits, increasingly prioritize institutional growth over community benefit. They accumulate billions in reserves. They pay executives millions in compensation. They compete for market share and profitable service lines like cardiac care, orthopedics, and imaging centers. They behave in many ways like for-profit corporations, even if their tax status says otherwise. Jackson Care Connect represents a fundamentally different answer to that question of who healthcare serves. It's a nonprofit coordinated care organization that exists solely to serve Oregon Health Plan members and improve community health. There are no stockholders to satisfy, no investors demanding returns, no corporate parent extracting profit. The organization is part of the Kara Reagan family, which has operated as a nonprofit since 1994. But Jackson Care Connect maintains local governance through a board of directors who live in Jackson County and a community advisory council where Oregon health plan members and community stakeholders have real power to shape priorities and funding decisions. This isn't just a feel-good mission statement. It's a structural difference that creates different incentives, different priorities, and ultimately different outcomes for our community. When Jackson Care Connect generates surplus revenue, and it does because managing healthcare efficiently creates savings, that money doesn't flow to shareholders. It gets reinvested locally. Over the past several years, that has meant tens of millions of dollars staying in Jackson County rather than flowing to distant investors. Now, let me explain how Jackson Care Connect actually works, because understanding the mechanics helps clarify why this model is different. Jackson Care Connect is what's called a Coordinated Care Organization, or CCO. This is part of Oregon's innovative approach to Medicaid, which is what we call the Oregon Health Plan locally. Rather than the traditional fee-for-service payment model, where providers profit from delivering more services, creating incentive to treat people when they're sick rather than keep them healthy, CCOs receive capitated payments. That means a fixed amount per member per month to cover all healthcare needs. This fundamentally changes the incentive structure. If you get paid the same amount, whether someone needs expensive emergency care or stays healthy with prevention and primary care, you're incentivized to invest in keeping people healthy. You're incentivized to address the upstream factors that create disease before they become expensive downstream crises. This is why Jackson Care Connect invests in things like housing and traditional health workers and school-based clinics. These aren't optional charity projects. They're smart investments that prevent more expensive interventions later. More importantly, CCOs are explicitly tasked with addressing social determinants of health. That's policy language for the real-world factors that shape whether you stay healthy or get sick. Housing, transportation, food security, education, social connection. The research is overwhelming on this. Your zip code predicts your health outcomes better than your genetic code. Whether you have stable housing affects your health as much as whether you have access to a doctor. A child's access to nutritious food shapes their health trajectory for decades. Traditional healthcare systems know this, but their structure doesn't allow them to act on it. If you're a for-profit insurance company, maximizing shareholder returns, you can't justify spending money on housing or food security. Those aren't billable medical services. If you're a hospital system paid through fee-for-service, you have no financial incentive to keep people out of your facility. But if you're a CCO with a capitated budget and a mission to improve community health, investing in social determinants isn't just ethical, it's financially smart and mission aligned. The governance structure is crucial here. Jackson Care Connect has a local board of directors made up of experienced healthcare providers and community members who live in Jackson County. These aren't figureheads. They meet bi-monthly at Addictions Recovery Center in Medford, not in Portland, not in some corporate headquarters, and they make decisions about priorities and investments that affect our community. Then there's the Community Advisory Council, which I think is one of the most important and underutilized features of this model. The CAC is composed of Oregon Health Plan members and community stakeholders who meet monthly to provide input on member needs, review grant applications, and shape community health priorities. And this isn't symbolic. The CAC has real power. They participate in funding decisions. They recommend changes to the board. If you're an OHP member or a community advocate who cares about how healthcare dollars get spent in Jackson County, This is where you can have direct influence. And yet, my experience is that most people don't even know the CAC exists, let alone that they could join it and shape these decisions. Jackson Care Connect also operates from downtown Medford with staff who live in and understand the community they serve. When the people making day-to-day decisions about care coordination and member services live in the same community, send their kids to the same schools, shop at the same stores, they understand local context in ways that distant corporate staff never can. They know that wildfire smoke is a chronic health issue here. They know that transportation is a barrier in rural areas. They know which neighborhoods lack access to fresh food. That local knowledge shapes better decisions. Let me walk you through some of the specific investments Jackson Care Connect has made, because this is where the model becomes tangible. Start with behavioral health, which is arguably the most acute crisis facing Jackson County right now. The shortage of inpatient psychiatric beds, the fentanyl crisis, the boarding of mental health patients in emergency rooms for days because there's nowhere else for them to go. Jackson Care Connect has responded to this crisis with over $8 million in investments. $4.5 million went to Addictions Recovery Center for withdrawal management services. Now, withdrawal management, sometimes called medical detox, is the process of safely helping someone get through the acute physical symptoms of stopping alcohol or drug use. This isn't the same as long-term treatment or recovery. It's the critical first step. When someone decides they're ready to get help for addiction, they often can't just stop using. The withdrawal can be medically dangerous, even life-threatening for alcohol and some other substances. Withdrawal management provides medical supervision, medication to ease symptoms, and a safe environment during those first crucial days. Before Jackson Care Connect made this investment, that capacity simply didn't exist at the scale we needed in Jackson County. People ready for help had to wait, and in addiction, waiting can mean the difference between recovery and relapse, or even death. $3.5 million went to OnTrack Rogue Valley for their family treatment campus. This is residential treatment specifically designed so that parents with substance use disorders can get treatment while maintaining connection with their children. Traditional residential treatment often requires parents to be separated from their kids for weeks or months, which creates an impossible choice: get treatment or maintain your family. OnTrack's model recognizes that family connection is actually protective for recovery outcomes, and that treating the whole family system produces better long-term results. Additional funding went to supportive housing through Columbia Care, providing transitional and permanent housing for people with behavioral health needs. The reality is, you can't stabilize someone's mental health or addiction recovery if they don't have stable housing. It's nearly impossible to attend therapy appointments, take medications consistently, or build a recovery routine when you're sleeping in your car or on someone's couch. The Big Pinky Emergency Shelter, the former Siskiyou Motel, now provides 12 rooms of emergency housing for people waiting for residential treatment. This addresses a specific gap: the person who's ready for treatment but has to wait days or weeks for a bed to open up. Instead of returning to unstable housing where relapse risk is high, they have a safe place to stay. Birch Grove Health Center received funding to support integrated care for over 1,300 high-needs patients through collaboration among La Clinica, Options, Columbia Care, Addictions Recovery Center, and OnTrack. This is what true integration looks like: not just coordinating care between providers, but actually bringing services together under one roof so people with complex needs don't have to navigate multiple systems. Jackson Care Connect has also strengthened what's called the Traditional Health Worker Network. And I want to spend a minute on this because it's one of the most innovative aspects of the model. Traditional health workers include recovery peers, doulas, and community health workers. These are roles that meet people where they are and provide support that traditional clinical care often can't. A recovery peer is someone who has lived experience with addiction and recovery. They've been through it themselves and are now professionally trained to guide others through that same journey. They can say, "I've been where you are, and I know the way out," in a way that a clinician without that lived experience simply can't. They understand the shame, the fear, the practical barriers, the internal dialogue that happens in early recovery. They can navigate the system because they've navigated it themselves, and the research shows that peer support dramatically improves long-term recovery outcomes. Doulas provide pregnancy and postpartum support. They're trained professionals who provide continuous physical, emotional, and informational support before, during, and after childbirth. Jackson Care Connect funds both traditional doulas and bilingual doulas for Spanish-speaking families. They bridge cultural gaps and provide continuity of care through pregnancy, birth, and early parenting that the fragmented medical system often fails to provide. A doula doesn't replace your doctor or midwife. They complement clinical care with the kind of sustained, personal support that helps people navigate one of the most vulnerable times in their lives. Community health workers help members navigate systems and connect to resources. If you've ever tried to help an elderly parent or a friend with limited English proficiency navigate the healthcare bureaucracy, you know how overwhelming it is. Community health workers meet people quite literally where they are, in their homes, in their communities, and help them access care they're entitled to but can't navigate alone. These roles are not traditionally billable medical services. A for-profit insurer has no financial incentive to fund them because you can't submit a claim for peer support or doula services the way you can for a doctor's visit. But Jackson Care Connect recognizes that these traditional health workers dramatically improve access to care, health outcomes, and member satisfaction, and they do it more cost-effectively than many traditional interventions. The structure makes it possible to invest in what works, not just what generates the highest billable revenue. School-based health centers are another major investment area. More than half of all Jackson County children are covered by Jackson Care Connect. Think about what it means to get health care as a kid when your parent is working multiple jobs, doesn't have reliable transportation, and can't easily take time off work. Traditional healthcare requires the parent to navigate scheduling, transportation, potentially lost wages, and the stress of getting a sick kid to a clinic. School-based health centers eliminate all of that. The kid gets care at school during school hours. The parent doesn't miss work. Transportation isn't a barrier. And the clinic can provide not just physical health services, but mental health support and dental care at some locations. Jackson Care Connect didn't just fund individual clinics. They created behavioral health in schools summits to strengthen relationships between schools and behavioral health providers, and played a lead role in establishing the Jackson Youth System of Care to help families navigate mental health supports. This is systems-level thinking. It's not enough to fund individual services. You have to build the infrastructure that connects services into a coherent system that families can actually navigate. One of the most innovative partnerships Jackson Care Connect has created is with Mercy Flights for mobile integrated healthcare. Traditional healthcare operates on the assumption that patients come to clinics. But what if you have mobility issues? What if you're homebound? What if you're experiencing a crisis and can't get yourself to care? Jackson Care Connect partnered with Mercy Flights to create teams that deliver care directly to members in their homes and communities. They do home safety checks that identify fall risks and prevent injuries before they happen. They provide medication management, ensuring people actually understand their prescriptions and are taking them correctly. They set up flu and COVID vaccine clinics in convenient locations rather than requiring people to come to a clinic. This kind of nimble partnership demonstrates what's possible when healthcare organizations prioritize member needs over facility-based revenue generation. Jackson Care Connect also makes community grants through what's called the Community Health Improvement Plan, or CHIP. These grants fund nonprofit organizations addressing housing, behavioral health, access to care, and community building. Recent grants have supported youth community centers, providing safe spaces and trusted adult connections. Fall risk assessments and home safety equipment for older adults and people with disabilities, street teams serving people experiencing homelessness, transitional housing with case management, parenting support programs for families with young children, fresh food access initiatives. And here's the crucial governance piece. The Community Advisory Council reviews grant applications and recommends funding. This isn't staff making decisions in isolation. It's community members with real power shaping where resources go. The time horizon is fundamentally different in this model. Corporations optimize for quarterly earnings. Private equity operates on 3 to 7 year cycles. Jackson Care Connect can think in 10-year time horizons because they don't have to deliver quarterly returns to shareholders. School-based clinics prevent problems decades later. Housing investments stabilize people for years. Workforce development builds sustainable capacity. This long-term thinking is only possible when structure doesn't force short-term profit extraction. The accountability structure is different too. For-profit companies are accountable to shareholders, period. Their fiduciary duty is to maximize shareholder value. Jackson Care Connect is accountable to members through the Community Advisory Council, to the state through quality metrics and community benefit requirements, and to the community through local governance. That creates different pressures and different priorities. The long-term impact on Jackson County extends beyond direct member services. And this is something I want to emphasize because even if you're not a Jackson Care Connect member, you benefit from this model. When anyone in Jackson County experiences an addiction crisis or mental health emergency or needs youth services, they benefit from infrastructure Jackson Care Connect helped build. The withdrawal management capacity at Addictions Recovery Center serves people regardless of their insurance. School-based health centers, while they prioritize JCC members, strengthen the overall community health infrastructure. Birch Grove's integrated care model demonstrates what's possible and influences how other providers think about coordination. The workforce development investments create jobs and build career pathways for community members. As recovery peers, doulas, and community health workers gain skills and certification through Jackson Care Connect funded training programs, they strengthen the regional health workforce. Some will eventually move into other roles or serve other populations, but they got their foundation through these investments. By funding community health centers, behavioral health programs, and supportive housing, Jackson Care Connect helps sustain provider organizations that serve everyone, including people with commercial insurance or Medicare. If Addictions Recovery Center or On Track or La Clinica struggled financially and had to close or cut services, everyone in Jackson County would feel that loss, not just OHP members. Jackson Care Connect's investments help ensure these critical providers remain viable. As one of Oregon's largest CCOs serving 67,000 people, Jackson Care Connect has a voice in state policy discussions. Local governance ensures that voice represents actual community needs, not corporate interests. When Jackson Care Connect advocates for policy changes in Salem, they're advocating for what their Community Advisory Council and local board have identified as priorities for Jackson County. Now, I want to talk about where the model could be even stronger, because I think it's important to look at this with clear eyes. Jackson Care Connect represents genuine innovation and a real alternative to corporate healthcare, but that doesn't mean we shouldn't advocate for it to improve. More systematic cross-sector data sharing could enable better coordinated interventions. If Jackson Care Connect, schools, housing providers, and social service agencies could share data more seamlessly, while protecting privacy, of course, they could identify people falling through cracks earlier and coordinate responses more effectively. We could also demonstrate the impact of social determinant investments on health outcomes more rigorously. Right now, it's difficult to draw direct lines between a housing investment and improved diabetes outcomes 3 years later, but with better data infrastructure, we could build that evidence. Rigorously tracking and publishing health outcome improvements, cost savings, and community benefit metrics compared to for-profit models would build the case for nonprofit community governance. The data exists to show whether this model produces better results. Making that data public and accessible would help other communities make the case for similar models. Jackson Care Connect could actively support other communities or states interested in similar CCO models. Oregon pioneered this approach, and it's working here. What would it take to help other regions learn from this experience and adapt the model to their contexts? That kind of knowledge sharing could spread community-focused healthcare beyond Oregon. Setting explicit targets for what percentage of resources go to upstream prevention versus downstream treatment would ensure sustained focus on long-term health improvement. It's easy to get pulled into putting out fires, responding to crises, funding emergency services, but the real power of this model is the ability to invest upstream. Setting targets like 30% of surplus investment goes to prevention and social determinants, and tracking progress would maintain that focus over time. Related to that, expanding integration with naturopathic doctors, chiropractors, and acupuncturists would strengthen the preventative aspects of care. We talked in our first episode about the Rogue Valley's unique integrative medicine culture. Imagine if Jackson Care Connect made it a priority to include these providers more systematically in care coordination, not as alternative options, but as first-line interventions for chronic pain, metabolic disorders, and stress-related conditions. This would align perfectly with the upstream prevention focus and leverage the regional strengths we already have. Finally, ensuring all contractors and grantees pay living wages would extend Jackson Care Connect's community benefit commitment throughout its funding ecosystem. If you're investing millions in community health infrastructure, but the people staffing those programs can't afford to live in the community, you're undermining your own mission. A living wage commitment would ensure that community health investments actually strengthen community economic health. If you're a Jackson County resident, healthcare provider, or advocate interested in community-governed healthcare, there are concrete ways to get involved. If you're an Oregon Health Plan member, you can join the Community Advisory Council. The CAC meets monthly and welcomes members and family members enrolled in OHP. Your voice shapes community health priorities and funding decisions. This is real power, and it's available to anyone who wants to show up and participate. If you run a community organization, you can apply for CHIP grants when cycles open. Jackson Care Connect funds projects addressing housing, behavioral health, access to care, and community building. If you're doing work aligned with community health priorities, this could be a funding source. Board meetings are open to the public with opportunities for comment. They happen bi-monthly at Addictions Recovery Center in Medford. If you want to see local governance in action, show up and bear witness. At the policy level, you can support Oregon's CCO model and similar community-governed healthcare approaches nationally. Contact Oregon legislators and your congressional delegation to express support for Medicaid innovations that enable community control. And share your story. If you've benefited from Jackson Care Connect services or community investments, tell people. Member stories influence priorities and demonstrate impact to policymakers. So let me bring this home. When Jackson Care Connect invests $4.5 million in withdrawal management, $3.5 million in family treatment, millions more in school-based health centers, and supportive housing, that's not charity. It's structural difference. Because there are no stockholders expecting dividends, surplus revenue stays in Jackson County. Because governance is local, decisions reflect Jackson County needs. Because the mission is whole person health rather than profit maximization, investments address social determinants that create health or disease. The 67,000 Jackson County residents covered by Jackson Care Connect benefit directly from this model, but the health infrastructure Jackson Care Connect builds, behavioral health services, school clinics, emergency capacity, workforce development, serves the entire community. For anyone wondering whether healthcare can function differently, Jackson Care Connect provides an answer. Healthcare organizations can be owned by communities, governed locally, accountable to members, and focused solely on health rather than profit. It requires different structure. It produces different outcomes. And in Jackson County, it's been working since 2012. That's over 12 years of proof that another way is possible. That's reimagining healthcare, not through medical breakthroughs or technological innovation, but through fundamental restructuring of who owns healthcare, who governs it, and who benefits from its success. Thank you for listening. If you want to learn more about Jackson Care Connect, visit jacksoncareconnect.org. If you want to get involved with Reimagine Healthcare's work, visit our website. And if this episode resonated with you, share it with someone who needs to hear that healthcare can serve communities instead of shareholders.